So today we would look at blood supply to the guts or the GIT. So blood supply to the digestive system, if you will, and we would look at blood supply to the stomach, the liver, the small intestines, and the large intestines. Although in a previous lecture, we already looked at blood supply to the liver and blood supply to the stomach. We'll just mention them a little bit in this lecture, and then we would focus on the small intestine and the large intestine. So, objective: to define, describe, and outline vertebral level of origin, course, and branches of distribution of the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. We had said in a previous lecture that the abdominal aorta gives rise to the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. But now we want to look at each of these arteries and their branches. And then we'll look at the pattern of blood supply to the stomach, the small intestine, and the large intestine. So the abdominal aorta, as we said in the previous lecture, begins at the aortic hiatus of the diaphragm, anterior to the lower border of the T12th vertebra, and then it descends through the abdomen, anterior to the vertebral bodies. And by the time it ends at the level of the L4 vertebra, we said it will split into the common iliac arteries when it ends. And then it is slightly to the left of the midline. And then the terminal branches of the abdominal aorta are the two common iliac arteries. Now, from this diagram, you would see this is showing the abdominal aorta, and then you have the celiac trunk here, and then you have your superior, this one is your superior mesenteric artery, and here you have your inferior mesenteric artery. Now, there are other branches you could see here, which we will discuss in some other lectures. Here you can see the renal artery, the right renal artery, this one, and here you find the left renal artery. So these are the paired branches, yeah? So the paired branches. And then here you have the right gonadal artery and the left gonadal artery going to the gonads. And you have your lumbar arteries, and then you have your right common iliac and your left common iliac and your middle sacral artery. But our emphasis today will be on the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery, because these are the blood vessels that supply digestive organs. We have no business with renal artery today, and we have no business with gonadal arteries. We want to focus on just stomach, the liver, the small intestine, and actually we talked about the liver already and the stomach, so we'll focus on the small intestine and the large intestine. So again, here we see the digestive system and the abdominal aorta. So in our previous lecture, we talked about the splenic artery that goes to the spleen. We talked about the left gastric artery and the right gastric artery, how they supply the lesser curvature of the stomach. And then we talked about also the epiploic or mental arteries that supply the greater curvature. And then, so here you will see your superior mesenteric artery coming downwards to supply the digestive system, the large and the small intestine. Okay, so this It's just a diagram that shows the branches. So the abdominal aorta has anterior, lateral, and posterior branches as it passes through the abdominal cavity. The three anterior branches supply the gastrointestinal viscera. So the abdominal aorta has anterior, lateral, and posterior, but our emphasis today will be on the anterior branches because these are the branches that supply the digestive system, which we said are made up of three main vessels: the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. Now, before going into details of the arterial supply of the gut, we need to understand how the gut is divided. So the gut, or the digestive system, if you will, is divided into the foregut, the midgut, and the hindgut region. So the foregut, the midgut, and the hindgut region. Now, the boundaries of these regions are directly related to the areas of distribution of the three anterior branches of the abdominal aorta. So the foregut has its own arterial supply, the midgut has its own arterial supply, and the hindgut has its own arterial supply. And remember, we said we have the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. So the foregut is higher, the midgut is in the middle, and the hindgut is below. In the same manner, we have the celiac trunk above, and then we have the superior mesenteric artery in the middle, and then we have the inferior mesenteric artery in the lower region. So that will show you which of these arteries will supply the foregut, the midgut, and the hindgut. And you need to know what organs make up each of the foreguts. So let's start with the foregut. Now, the foregut begins with the abdominal esophagus and ends just inferior to the major duodenal papilla, midway along the descending part of the duodenum. So your foregut begins at the abdominal esophagus. Remember when we talked about the esophagus, when we talked about the stomach, we said that the first part of the stomach that connects the stomach to the esophagus is called the cardia. Now, the cardia, if you remember, that's that part. So the lower part of the esophagus that connects to the stomach is the origin of the foregut. So the foregut starts with the abdominal esophagus, and then the foregut ends in the duodenum. So here, so everything you see in yellow here, in this picture, everything you see in the yellow color makes up is part of the foregut. So the foregut here, we have the abdominal esophagus, and then we have the stomach. This is the stomach you can see here. And then, you say we have the pylorus of the stomach. And then after that, you have the first part of the small intestine, which is the duodenum, So in this picture, you can only see the ending part of the esophagus, the stomach, and then the first part of the small intestine, which is called the duodenum. So these make up the foregut. But in addition to the stomach and the duodenum, there are other organs that are part of the foregut. An example is the liver. So you know that the liver would be found on the right side, of the stomach. So the liver will be somewhere here, but it's not in this diagram. So you have the liver, and then you have your pancreas also, and your gallbladder, which is attached to the liver. Then the spleen also develops in relation to the foregut region. Now, when we talk about digestion, we will only be focusing on stomach and duodenum. That is why we didn't put a diagram of the liver and the pancreas here, okay? But our focus is on stomach, small intestine, and large intestine. So that makes up the foregut. So if they ask you what are the organs that make up the foregut, you mention abdominal esophagus, the stomach, the duodenum, the liver, the pancreas, the gallbladder, and the spleen. Now, all of these organs are supplied by branches of the celiac trunk. That was why when we were looking at the stomach, blood supply to the stomach, we saw that all the blood vessels that supply the stomach came from the celiac trunk. There were branches of the celiac trunk. When we also talked about blood supply to the liver, we saw that the arterial supply to the liver also came from the celiac trunk. So know that the foregut is supplied by the celiac trunk. So all of these organs will be supplied by the celiac trunk. Then, okay, let's move to the next slide. So let's look at the celiac trunk. The celiac trunk is the anterior branch of the abdominal aorta that supplies the foregut, as we already said. It arises from the abdominal aorta immediately below the aortic hiatus of the diaphragm, anterior to the upper part of the first lumbar vertebra. It immediately divides into the left gastric. Remember, the left gastric artery, we said, supplies the lesser curvature of the stomach, so the left gastric. It sends esophageal branches upward to the abdominal part of the esophagus. And then the left gastric artery itself turns to the right and descends along the lesser curvature. And there it's anastomosis with the right gastric artery. This we already discussed in the previous lecture, that the left gastric artery anastomoses with the right gastric artery and supplies the lesser curvature of the stomach. Now, here you would see, this is what we're talking about. This is the lesser curvature of the stomach, lesser curvature of the stomach. So you will see the left gastric artery and the right gastric artery will anastomose to supply the lesser curvature of the stomach. And they are coming from the celiac trunk. They are branches of the celiac trunk. Then we mentioned the splenic artery also. So the splenic artery, second branch of the celiac trunk, the splenic artery, which supplies the spleen. It takes a tortuous course to the left along the superior border of the pancreas. It supplies the neck, body, and the tail of the pancreas. So the pancreas is supplied by the splenic artery also. And then it then travels in the splenorenal ligaments and divides into numerous branches, which enter the hilum of the spleen to supply the spleen. Now, the splenic artery also gives off some short gastric arteries, which we saw in the previous lecture. That the splenic artery gives off some short gastric arteries, which supply the stomach, and they pass through the gastrosplenic ligaments to supply the fundus of the stomach. If you can remember very well in the diagram, the upper part of the stomach, the fundus, is supplied by the short gastric arteries, but they are coming from the splenic artery. And then it also gives off the left gastro-omental artery, which runs to the right along the greater curvature of the stomach and anastomosis with the right gastro-omental artery. So the greater curvature of the stomach is supplied by the left gastro-omental and the right gastro-omental artery. But the left gastro-omental artery is coming from the splenic artery. Now, the third branch of the celiac trunk is the common hepatic arteries, which goes to supply the liver majorly. So it runs to the right and divides into its two terminal branches. The two terminal branches are the hepatic artery proper, or proper hepatic artery, which gives right gastric artery, right and left hepatic arteries. So hepatic artery proper gives right gastric artery, right and left hepatic arteries. And then the right hepatic artery nears, as the right hepatic artery nears the liver, it gives off the cystic artery to the gallbladder. So the gallbladder is supplied by the cystic artery, which is a branch of the right hepatic artery, And the right hepatic artery itself is a branch of the proper hepatic artery, which comes from the common hepatic artery, which is the branch of the celiac trunk. Then the common hepatic artery has a second branch, which is the gastroduodenal artery. So this gives off the supraduodenal artery, going to the duodenum, the right gastroomental artery, which passes to the left along the greater curvature of the stomach. Remember, we said that the greater curvature is supplied by the right gastroomental and the left gastroomental. Left gastroomental is coming from the splenic artery, but the right gastroomental is coming from the gastroduodenal artery, which is a branch of the common hepatic artery. But all of them are still coming from the celiac trunk. Eventually, anastomosis with the left gastroomental artery from the splenic artery. So right gastroomental artery from gastroduodenal artery, anastomose with the left gastroomental artery from splenic artery to supply the greater curvature of the stomach. And then the third branch of the gastroduodenal artery will have the superior pancreaticoduodenal artery. This artery divides into anterior and posterior branches as it descends and supplies the head of the pancreas and the duodenum. So from the name, pancreaticoduodenal, so it supplies head of pancreas and duodenum. But again, they are all coming from the celiac trunk. And let's go to the midgut. So what do we have in the midgut? The midgut begins just inferior to the major duodenal papilla. The major duodenal papilla, below it. Everything above the major duodenal papilla is in the foregut. And then below the major duodenal papilla, we have the midgut in the descending part of the duodenum. And then it ends at the junction between the proximal 2/3 and distal 1/3 of the transverse colon. So from the duodenum to the transverse colon, we have the midgut. And what are the organs that we have? What structures do we have in the midgut? So we have the duodenum. Remember, we said that the duodenum is also part of the foregut, but the part of the duodenum that is superior to the major duodenal papilla is in the foregut. But the part of the duodenum inferior to the major duodenal papilla is in the midgut. And then in the midgut, we have the jejunum, the ileum, the cecum and appendix, and the ascending colon. And then we have the right 2/3 of the transverse colon. I'm going to show you a diagram where you will find all of these organs. So jejunum, ileum, cecum are just part of your large intestine. So this is just your large intestine. Ascending colon, these are all part of your large intestine, while the jejunum and the ileum are part of the small intestine. So the small intestine, you have your duodenum, your jejunum, and your ileum. And then your large intestine, you have your cecum, appendix, and the ascending colon, making part of the midgut, and a little part of the transverse colon. But your descending colon and your sigmoid colon will be part of the hind guts. So what blood vessel supplies the midgut? We said it is the superior mesenteric artery. So celiac artery supplies foregut, while superior mesenteric artery supplies the midgut. Now let's look at the superior mesenteric artery and the branches of the superior mesenteric artery. Since we already know the organs that are in the superior that are in the midgut, so we should expect the superior mesenteric artery to give branches to each of these organs. Now, it is the anterior superior mesenteric artery. It is the anterior branch of the abdominal aorta supplying the midgut. It arises from the abdominal aorta immediately below the celiac artery, anterior to L1 vertebra. it gives the following branches. So the inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. So you see that this artery is going to be supplying also pancreas and some part of the duodenum. So this is anterior arterial network, supplies the head and uncinate process of the pancreas and the duodenum. Remember that in the celiac trunk gave a superior pancreatico-duodenal artery, but the inferior pancreatico-duodenal artery is from superior mesenteric artery. And then we said we'll have the jejunum and the ileum in the midguts. So the superior mesenteric artery will also give supply. So we'll have the jejunal arteries and the ileal artery. So jejunal artery will supply jejunum, ileal arteries will supply ileum. That is part of the small intestine. And then they form single and double arcades in the area of the jejunum and more arcades in the ileum. So they form like a network, right, supplying the jejunum and the ileum. Then the third branches of the superior mesenteric artery are the middle colic, right colic, and ileocolic artery. So these ones are supplying the large intestine, some supplying the ascending colon, transverse colon, and some parts of the connection between the ileum and the ascending column. That is what we call the ileocolic artery, you will see in the diagram. Now, so they supply the terminal ileum, the cecum, the appendix, ascending colon, and 2/3 of the transverse colon. 2/3 of the transverse colon. The other 1/3 of the transverse colon will be supplied by the inferior mesenteric artery. So look at the diagram here. So everything we've been saying, let's look at it in this diagram. Now, here you find your ascending, first of all, you find your appendix, and then here you find your cecum. This is cecum, where the appendix is attached, and then you have your ascending colon, and then your transverse colon, 2/3 of your transverse colon. So in this diagram, we didn't see the descending colon and the sigmoid colon because they are not supplied by the superior mesenteric artery. So this artery here, this main artery, big one, is the superior mesenteric artery. So let's see the branches that come from it. The first branch here, this one, is the inferior pancreatico-duodenal artery, which would run to go supply the pancreas and the duodenum. So some part of the pancreas and the duodenum will be supplied by the inferior mesenteric, sorry, the inferior pancreatico-duodenal artery. So this is it here. This one is called the branch of the superior mesenteric artery. Then we have the jejunal arteries. So here you find the jejunal artery forming a network. So this is your jejunum. This is your jejunum, and this down here is your ileum. So this is your ileum down here, while this is your jejunum, part of the small intestine. Now, the jejunum is supplied by the jejunal artery. So these are the jejunal arteries coming from the superior mesenteric artery, this jejunal artery. They form a network here supplying the jejunum. And then this is your ileum, as we said. Then you will see these are ileal arteries. These ones, they're also coming from the superior mesenteric artery. So they form branches here to supply the ileum. So we'll call them the ileal arteries. So these are ileal arteries, and these are jejunal arteries. So they are the second branch of the superior mesenteric artery, with the first branch is the inferior pancreatico-duodenal artery, and then you have the jejunal arteries and the ileal arteries. Then the third branch, you have the right colic artery. So right colic artery, look at it. This is right colic artery. This right colic artery is going to supply the ascending colon. So this is your ascending colon, as you can see here. So right colic artery will go and supply ascending colon. And then you have your middle colic artery. So your middle colic artery is going to supply the transverse colon. 2/3 of the transverse colon is supplied by the middle colic artery. So remember that. Right colic artery supplies ascending colon. Middle colic artery supplies 2/3 of the transverse colon. Here, we did not label the left colic artery because the left colic artery is not a branch of the superior mesenteric artery. So here, we are not going to talk about it because it doesn't supply the organs here. It will supply organs in the hind guts. Now, let's look at another artery that we mentioned, which we said is the ileocolic artery. So here you see ileocolic artery. Now, this is it. This is ileocolic artery, which is also part of the branches of the superior mesenteric artery. So from the name ileocolic, it shows you that it supplies ileum and colic, so ascending colon. Yeah. So here you see this artery giving rise to some branches that supply. This is the junction between the ileum and the ascending colon. So the ileocolic artery comes to supply this place, this junction between the ileum and the ascending colon. Okay, now, so these are the major arteries of the branches of the superior mesenteric artery, and we said they supply the mid gut. They supply the mid gut. So arteries that supply the mid gut, the main artery is superior mesenteric artery, the branches, the inferior pancreaticoduodenal artery, and then the middle colic artery supplying transverse colon, the right colic artery supplying ascending colon. Then you have the ileocolic artery supplying, the junction between the ileum and the ascending colon. And then you have your jejunal artery supplying the jejunum. And then you have your ileal arteries supplying the ileum. Okay. Now let's go to the hind guts. So the hind guts is the lower parts. It begins before the left colic flexure, the junction between the proximal 2/3 and distal 1/3 of the transverse colon. The junction between the proximal 2/3 and the distal 1/3 of the transverse colon. So at that place, we'll have what we call the left colic flexure. Now, it ends midway through the anal canal. So your hind gut begins from the left colic flexure and ends in the anal canal. I think there should be a diagram that explains that. I'll show you a diagram that explains that. So what are the structures or the organs you find in the hind gut? So you find the left 1/3 of the transverse colon. Remember that the first 2/3 of the transverse colon are in the mid gut, but the left 1/3 of the transverse colon are in the hind gut. And then you have your descending colon, your sigmoid colon, and your rectum, and then the upper part of the anal canal. The hind gut is supplied by the inferior mesenteric artery. Hind gut, inferior mesenteric artery. Mid gut, superior mesenteric artery. Foregut, celiac trunk. So don't forget that. Blood supply to the foregut is through the celiac trunk. Blood supply to the mid gut is through the superior mesenteric artery, and blood supply to the hind gut is through the inferior mesenteric artery. So let's see. The inferior mesenteric artery is the anterior branch of the abdominal aorta that supplies the hind gut. It arises anterior to the body of L3 vertebra. The branches include left colic artery. So I told you before that the left colic artery is not part of superior mesenteric artery because it is a branch of the inferior mesenteric artery. So what does it do? What does it supply? It's going to supply the descending colon. So the ascending branch supply the upper parts of the descending colon and the distal part of the transverse colon. And then it's anastomosis with branches of the middle colic artery. So the left colic artery will give some branches that will supply the descending colon and the distal part of the transverse colon, and then it will anastomose with branches of the middle colic artery. The descending branch passes inferiorly, supplying the lower part of the descending colon and anastomosis with the first sigmoid artery. The left colic artery has anastomosis with middle colic artery and sigmoid artery. Left colic artery has anastomosis with middle colic artery and sigmoid artery. Before its anastomosis with middle colic artery, it first gives branches that will supply the upper part of the descending colon and the distal part of the transverse colon. Before anastomosing with the sigmoid colon, it first gives branches that will supply the lower parts of the descending colon, the lower part of the descending colon. So it means that the left colic artery supplies the upper part of the descending colon and the lower part of the descending colon also. Supplies upper part and lower part. After supplying upper part, it's anastomosed with middle colic artery. And then after supplying lower parts of descending colon, it's anastomosis with the first sigmoid artery. So let's look at this beautiful diagram, very beautiful diagram here. Now let's identify our inferior mesenteric artery. So here you find your inferior mesenteric artery. So this is your abdominal aorta here, okay? Now here you find your superior mesenteric artery and here your inferior mesenteric artery. So the inferior mesenteric artery, we said, it will give the first branch, the left colic artery, left colic artery. So the left colic artery has an ascending branch and a descending branch. Ascending branch and descending branch. So we said that the ascending branch will go and supply the upper part of the descending colon, upper part of the descending colon, and then it will anastomose with the middle colic artery. Now, it will supply upper parts. Remember, ascending branch of left colic artery will supply upper part of descending colon, and then the distal 1/3 of the transverse colon. So if I could show you your digestive system, you will see your transverse colon up here, right? So this is your transverse colon, but it's not shown here. So the distal 1/3 of the transverse colon will be supplied by the ascending branch of the left colic artery. And then it will anastomose with this is middle colic artery, yeah, middle colic artery. So the middle colic artery, some branch will come and anastomose here with the ascending branch of the left colic artery. Then the descending branch of the left colic artery, descending branch, will come and supply the lower part of the descending colon, which you cannot see in this diagram, but it supplies the descending parts, or the lower part of the descending colon, and then it's anastomosis with sigmoid arteries. So that was what we said in the previous slide. that the descending branch will supply the lower part of the descending colon and then anastomose with the sigmoid arteries. Okay, so we don't have the diagram of the descending colon in this diagram, but just know that your descending colon is here on this side, and then the descending colon continues as a sigmoid colon, and then the sigmoid colon continues at the rectum anatomically. Now, if we look at the superior mesenteric artery also, we'll find the branches, middle colic artery, which supplies the to third, right, anterior to third or proximal to third of the transverse colon, as we said before. And then we'll have the right colic artery, which is going to supply the ascending colon, And then we'll have the ileocolic artery, which goes to supply some parts or the junction between the ileum and the ascending colon. So you have the colic artery and the ileal artery. So the ileal arteries will go and supply the ileum. And then in this diagram, we cannot find the jejunal arteries. They are not labeled here, but the jejunal arteries will go and supply the jejunum. Okay, good. So sigmoid arteries. Now let's look at sigmoid arteries. So the sigmoid arteries are the second branch of the inferior mesenteric artery. Remember, we said that the inferior mesenteric artery, the first branch is the left colic artery, which supplies the descending colon and the distal part of the transverse colon. So the second branch is the sigmoid arteries. They supply the lowest parts of the descending colon and the sigmoid colon. And then its branches anastomose superiorly with branches from the left colic artery and inferiorly with branches from the superior rectal artery. So the sigmoid artery will anastomose with the left colic artery superiorly, and then it will anastomose with the superior rectal artery inferiorly. Then the third branch of the inferior mesenteric artery is the superior rectal artery. It is the terminal branch of the inferior mesenteric artery, supplying rectum and upper portion of the anal canal. So remember that we said that in the hind guts, we have the anal canal, we have the rectum, right? We have the descending colon and a part of the transverse colon. So all of these organs are supplied by the inferior mesenteric artery. But the sigmoid artery will supply the sigmoid colon, the superior rectal artery will supply the rectum and the anal canal, while the left colic artery, which is the first branch of the inferior mesenteric artery, will supply the descending colon. So there was a diagram I saw earlier. Let me see if I can see the diagram again. Okay. This diagram, this one, we are supposed to have our descending colon down here, and then our sigmoid colon and our rectum. So all the blood vessels we mentioned now would supply that part. Okay, so let's see clinical anatomy. What would happen if we have some problems with the blood supply of the digestive system? So we have a syndrome that is called the celiac axis syndrome. So this occurs when the celiac trunk is compressed by the diaphragmatic crural, leading to reduced blood supply to the foregut. So the diaphragm has it has a dome, right? Now, some part of the diaphragm could compress the celiac trunk, And once that happens, it means that blood cannot flow freely through the celiac trunk to supply the organs of the foregut, because we said the celiac trunk supplies the organs of the foregut. So when there is a compression of the celiac trunk, there is reduced blood supply to the foregut. So it means that all the organs that are in the foregut will not receive adequate blood supply. So there will be shortage of blood supply to the stomach, there'll be shortage of blood supply to the pancreas, shortage of blood supply, you know, to the spleen, and of course the liver if there is compression of the celiac trunk, and it presents with pain. So all of these organs, the patient will feel pain in the stomach or pain in the liver just because blood is not getting there. And why is blood not getting there? Because the celiac trunk is compressed by the diaphragm. Okay, so intestinal angina. So intestinal angina is a condition which happens when there is atherosclerosis or other narrowing of the mesenteric arteries. So if there is some atherosclerosis or some fat deposits, right, in the mesenteric arteries that narrow the lumen of the arteries or blocks blood supply or blood flow through the arteries, it means that there will be what we call ischemia. So the organs that are supplied by the mesenteric arteries will suffer ischemia, and that ischemia would lead to pain. There'll be pain in the intestines because we said that the mesenteric arteries supply the intestines. So if there is obstruction, atherosclerosis, there is a sclerosis caused by a plaque, fat plaque in the mesenteric arteries, it means that the intestines will not get enough blood supply, and that will result to pain, and that pain we'll call it angina. Okay, so we'll have intestinal angina. Now, it is worsened by eating, and so victims tend to avoid eating. So when the patient finished eating, the pain increases. Okay, so we'll call that intestinal angina. The impaired absorption and food avoidance lead to wasting of the victim. So now what does this mean? In a patient with intestinal angina, there is impaired absorption of food. Why? Because food absorption takes place in the intestine, in the small intestine, right? But now, for that small intestine to perform its function, it needs blood supply. And that blood that is coming is bringing energy, you know, and oxygen to that intestine. But now there is obstruction, there is atherosclerosis of the mesenteric arteries. So it means that the intestines are no longer receiving enough oxygen, and so they don't have enough energy, and they cannot perform their normal function of absorption. And once there is no absorption, all the nutrients in the food that you have eaten cannot get into your blood and be transported to different parts of your body. So what happens? The patient becomes slim, very slim, because the patient begins to lose a lot of weight. Why? Because all the food that you eat, they are digested, but they cannot be absorbed into the systemic circulation to be transported to all the tissues and organs that need these nutrients. So what happens is that the person loses weight. That's what we call wasting, right? Wasting. And then we also said that because of the pain, the patient avoids eating. And when you don't eat, what happens? You lose weight. So that there'll be wasting of the victim. So remember that in intestinal angina, the patient will feel pain, and the pain will worsen after eating. And the patient, because he wants to avoid the pain, will avoid eating food. So avoidance of food and impaired absorption will make the patient to lose a lot of weight. Okay. Now, the third The third thing you need to know, clinical and anatomy, is what we call mesenteric artery thrombosis. Mesenteric artery thrombosis. So in this mesenteric artery thrombosis, we have a kind of blood clot, right? A blood clot blocking the mesenteric artery. When this happens, there will be what we call gut gangrene. Gut gangrene. So the guts or the GIT, the intestines, will no longer be able to receive blood supply. And when that happens, they will begin to undergo a kind of necrosis or destruction. So the cells will begin to die. And then we'll have a gangrene, gut gangrene in the areas where the blood supply does not get to. The whole entire gut will not be blocked. It depends on which part of the mesenteric artery will have the thrombosis, which of the branches will have the thrombosis. So that area is what we call watershed areas. So these areas are the places where blood cannot get to because there is thrombosis of the blood vessel. So the areas of the colon where branches of major arteries are vulnerable to ischemia are called the watershed area. So those are the regions that are vulnerable to ischemia. Blood cannot get to those regions. We'll call that watershed area. So that's mesenteric artery thrombosis. And then we have what we call the superior mesenteric artery syndrome, which is a very rare syndrome, but it is a life-threatening gastrovascular disorder. It is characterized by a compression of the third portion of the duodenum by the abdominal aorta and the overlying superior mesenteric artery. So compression of the third portion of the duodenum by the abdominal aorta and the overlying superior mesenteric artery. So when you compress the duodenum, to some extent, the superior mesenteric artery and the abdominal aorta cannot properly supply blood to the duodenum, and that means that the duodenum would not be able to perform its function. So quickly, let's do a recap, quick recap. So we said that the blood supply to the gut is done by three main blood vessels. And these three main blood vessels are the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. And we said that the gut is divided into the foregut, the midgut, and the hindgut. Foregut, midgut, and hindgut. So the foregut, we said, will be supplied by the celiac trunk, while the midgut will be supplied by the superior mesenteric artery, and then the hindgut will be supplied by the inferior mesenteric artery. And then we said that the celiac trunk, which is the blood supply to the foregut, is made up of different branches. By the way, the organs of the foregut you should know: abdominal, esophagus, the stomach, the duodenum, the liver, the pancreas, and the gallbladder, and then the spleen. So all of these organs will be supplied by the celiac trunk, which we already talked about. And the celiac trunk, we said it has the left gastric artery, and the splenic artery, and the common hepatic arteries. So all of these supply the foregut. And then the midgut, we said it contains the jejunum, the ileum, the duodenum, some part of the duodenum below the duodenal papilla. And then we'll have the cecum, the appendix, and the ascending colon, and then the transverse colon. They are supplied by the mesenteric artery. And we'll have the mesenteric artery will give different branches. So we'll have the jejunal arteries, the iliac artery, we'll have the cecum and appendix supplied also by the iliocolic arteries, and then we'll have the ascending colon supplied by the right colic artery, and then we have the right two-thirds of the transverse colon supplied by the middle colic artery. And then, yeah, we already said this. Then this diagram simply shows you the different branches of the superior mesenteric artery, the inferior pancreatico-duodenal artery, the middle colic artery, the right colic artery, the iliocolic artery. and then the jejunal arteries and the iliac arteries supplying the midguts. And then the hindgut, we said, is made up of the left 1/3 of the transverse colon, the descending colon, the sigmoid colon, rectum, and the anal canal, and they are supplied by the inferior mesenteric artery. And so the branches will have the left colic artery, which supply the descending colon. Ascending branch, it has an ascending branch and a descending branch. So the ascending branch supplies the descending colon and the distal part of the transverse colon, while the descending branch supplies the lower part of the descending colon, and then anastomose with the sigmoid artery. And then the sigmoid artery, they will supply the sigmoid colon, and then the superior rectal artery will supply the anal canal and the rectum. So basically, that is everything you need to know about blood supply to the digestive system. Do not forget them. They're very, very important. Very, very important. And in any exam, you're going to be asked, especially about the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. You must remember them. You must remember the organs that make up the foregut, the midgut, and the hindgut. And know that celiac trunk supplies foregut, midgut is supplied by the superior mesenteric artery, and the hindgut is supplied by the inferior mesenteric artery. Good. Do you have any question?
No, sir.
Okay, good. So thank you and see you soon.
Thank you, sir.
Yeah. Bye.